This is the cranial nerve testing with A.J. McCleary as doctor, Joe Johnson as patient, and Danny Adams as your narrator. We're going to first check the cranial nerve 1, which is the olfactory nerve, dealing with smell. The doctor will have the patient occlude one nostril, closing his eyes, while holding a familiar smell. Put it up to each nostril and compare the odor, and notice if the patient can identify the odor.
Cinnamon. Good. Cover the other one. What about this one?
It's also cinnamon.
That's right. Any difference between the two?
No, they're equal.
Okay.
They should be equal, but any unilateral loss would be indicative of a frontal lobe lesion. The optic nerve, cranial nerve 2, there are many tests you can do: visual acuity, color vision, confrontational fields, pupils, and direct ophthalmoscopy. In this instance, we will have the doctor do confrontation visual fields.
Perfect. I'm going to have you go ahead and close your left eye for me. And now look at my open eye. And using just your side vision, go ahead and count fingers for me.
2, 5,
Mm-hmm.
1, 2,
Excellent. Cover your other eye for me. Now looking at this open eye, use just your side vision.
2,
Perfect.
1, 1,
Mm-hmm.
5.
Perfect. Very good.
There are no deficits there. For cranial nerves 3, 4, and 6, we are able to do extraocular muscles, check those out, and look for any deviation.
Perfect. So what I'm going to have you is just watch the tip of this tuning fork here, and let me know if you experience any pain or double vision as I move it to different spots. So moving it out there, bearing the sclera there, making sure the eyes are moving together. See any deficits there. Good. Excellent. Keep watching that for me. Did you experience any pain or double vision there?
Nope.
Muscles worked very well. Movements were symmetrical.
Continuing on to cranial nerve 5, the trigeminal nerve, the doctor will have the patient clench his teeth while palpating the masseter muscles, looking for symmetry.
All right, so I'm going to have you start by unclenching your teeth. Now clench your teeth, and now unclench, then clench. Perfect. They're symmetrical response both sides.
This can also be checked by checking all three branches of the sensory system by using a cotton wisp, a cotton tip applicator to touch the skin on all three, the ophthalmic, maxillary, and mandibular,
Perfect.
checking for equal responses.
I'm going to have you close your eyes for me, and I want you to just compare the responses here. So can you feel that?
Mm-hmm.
And this one,
Mm-hmm.
and here.
Yep.
Okay. Come to the other side. Okay, right there.
Mm-hmm.
Right there.
Yep.
And here.
Yep.
And do they all feel about the same?
Yep.
Excellent.
Continuing on to cranial nerve 7, the facial nerve, the patient will have his eyes closed and attempt to force the eyelids open.
Perfect. So I'm going to have you just try and clench those eyelids down. I'm getting an equal resistance on both sides.
It can also be tested by having the patient smile or frown and
Okay.
looking for equality in the muscles.
Go ahead and smile for me. Very good. And frown. Very good.
Another test you can do is have the patient puff out the cheeks while the examiner resists against it, looking for equality amongst the
Okay.
response.
Go ahead and puff out your cheeks. Okay, equal response on both sides.
Now, while checking cranial nerve 8, we'll be using a tuning fork to test the nerve. The tuning fork will be struck and placed on the vertex of the scalp.
Perfect. Just compare.
The patient should hear the sound equally on both sides.
Correct, I do.
Excellent.
Next, you can strike the tuning fork and hold it against the mastoid process until the patient can no longer hear it.
Okay.
And then move the fork in front of the same ear.
Okay.
Good, I don't want to hear it. Yeah, louder.
Okay.
The response should be louder in air. The same is done on the other ear.
I don't hear it anymore. Yeah, it's louder there.
Excellent.
Moving on to the cranial nerve 9 and 10. We've heard Joe speak a little bit, but we'd love to hear him say his name.
Joseph Johnson.
Looking for any hoarseness, that may be present. Also, you can use a tongue depressor, have the patient stick out his tongue and say ah, looking at the uvula and soft palate.
Okay. Perfect. Staying right in the middle.
The uvula should stay centered. If there's a deficit, the uvula will deviate towards the normal side. Now checking the spinal accessory nerve, cranial nerve 11, the patient should raise his shoulders while the examiner pushes down. The resistance should be equal on both sides.
Okay, so just relax right now. Now resist, push up, good. All right, resistance is equal on both sides.
It also can be checked by having the patient look towards one side while the practitioner resists against the other way.
Okay, turn your head to the right. Good. Now turn your head to the left. Good.
We're looking for
Resistance is equal.
we're looking for symmetry there as well. And finally, cranial nerve 12, the instruct the patient to stick the tongue out, and any deviation should be noted.
All right. And it's right down the middle.
If there is any deviation, it will deviate towards the weaker side. You can also press against the cheek while having the patient press his tongue against it and checking for equality there.
Okay. Perfect. Equal response.
Equality there. All right.